I was in a ski lift accident up at Whistler in 1995 when some chairs fell off the ski lift, and that was how I got injured. So I have a thoracic T4 level complete spinal cord injury. And after a few surgeries and rehab and whatnot, then I developed neuropathic pain at the level of my injury around 1996 or so, for who knows why, just part of the injury, part of an infection, or part of a surgery. But that's kind of bothered me ever since then. And it comes and goes. I'd say it's mostly mild, sometimes moderate. Have good days, bad days, just like most of you, I'm sure. And for me personally, I use a little bit of medication, gabapentin. I'm sure you're probably all familiar with that. That seems to do the trick to just bring it down a little bit for me. But otherwise, I don't take anything else for it, and I just try to kind of deal with it best I can. Yeah, so that's my story. So I've been working at VGH for about 15 years, and yeah, that's about it, I'd say. Yeah, I see a little bit of every kind of pain. I also do a little bit of medical legal work for people that have been in car accidents. If the lawyers need someone to kind of document their pain story and come up with a diagnosis or make some suggestions for their treatment or their lawsuit, then I do that as well. So yeah, so I'm happy to take any questions even just about that, all that personal stuff if you like.
Awesome. Mike, can you tell us maybe about any new research that's coming out?
For pain specifically, well, with neuropathic pain, which is a big part of spinal cord injury pain, not a lot has changed in the last 10, 15, well, even 20 years. The last new drugs really that came out for treating neuropathic pain were pregabalin, and that's been around for a long time already. So we haven't had any breakthrough treatments at all for really neuropathic pain. People have used some topical creams for it a lot more in the last decade, and sometimes that's helped a little bit, medications within creams. There's a bit of work around using some of the stimulation therapies, like there's a technique called repetitive transcranial magnetic stimulation, which is basically a device that you put on your head over top of your scalp, and that delivers electromagnetic energy to your brain essentially. And it was developed for treating depression, and they discovered that some people who had depression and chronic pain also found their chronic pain got better. So there's a group out at UBC doing a bit of research on that with chronic pain, and there's a psychiatrist in town that has started to use that as well for treating chronic pain in a semi-private kind of clinic as well. But it's pretty early days. I don't think we really know a lot about how well that's going to work. There was some people studying it down in Australia, and they actually canceled or stopped one of their studies because some people they found were actually having some worse pain problems. So this is kind of the nature with pain, is we don't fully understand how some of these treatments work or not, and so you can get some unexpected results. What else? I guess like in the last probably 5 to 10 years too, there's been a lot more understanding and research around how the immune system is partly responsible for making our injured nerves generate pain. So there's been a lot of focus and effort on immune system-based therapies that may modify it, rather than most of these drugs we use are trying to dampen down the nerve cells from being so hyperexcitable. So pregabalin and gabapentin and nortriptyline and amitriptyline and nabilone and cannabinoids and everything, they all work mostly by just cranking down the sensitivity of the nervous system. And then unfortunately that can be a bit of a global thing, so that doesn't just target the nerve cells, it targets your brain and everything else, so you get sleepy and other kinds of side effects. So immune therapies, while again they're not ready at all for any kind of prime time treatment or even clinical trials yet, but I think that's going to be an exciting area in the future for treating some of this neuropathic pain. So that should be coming down the pipe eventually. What else? Yeah, you know, opioids, they do have a role sometimes. Some of these medications can play a role in neuropathic pain treatment as well. But you know, there's not a lot else new coming around yet. It would be nice if we could treat some of the underlying neurologic injury in the first place, because if we could do that, we'd probably get rid of some of the neuropathic pain. But that's been really slow as well in terms of stem cells and other kinds of treatments. I'm not seeing a lot come through in terms of clinical results that we could sort of say to people like yourselves, hey, this is here soon, and you're going to be, you know, asked to join trials. So we're just not there yet with any of it yet. So we're still pretty much using mostly our old therapies from 20 years plus. Still, a lot of these drugs have been around a long, long time.
Okay, awesome, thank you. Another question, just to get down to basics. Why do we have nerve pain?
Well, if I just try to explain it to someone in easy, just general terms, I say it's just kind of a bad side effect of the nervous system trying to heal itself, basically. As we know, it doesn't spontaneously heal very well, because we wouldn't be sitting around in chairs if that was the case. So in its effort to kind of create sprouting and try to find pathways to reestablish connections again, it doesn't do that very well, and one of the side effects seems to be pain. Various theories about that. The injured nerves often lack some self-control, basically, and they get hyperexcitable. The brain that is supposed to be integrating all of our sensory information from our limbs, like in normal non-injured people, it doesn't have all that information now. So if you have a limb that's either missing or you can't feel it, then your brain's not getting information about that part of your body, and it also tries to preserve knowledge about that part of your body by creating some new connections and new sprouts and turning up the dial a little bit on the sensitivity, and as a result we begin to get pain again. So it's certainly, the neuropathic pain is certainly not adaptive. It serves no purpose. It's a completely maladaptive, bad thing that happens from the result of nerve injuries. And it's actually, not that different than even chronic pain that started from some other kind of, tissue injury problem, where you can still feel the tissue, but the sensitivity of the nervous system just gets cranked up a lot. And as a result, chronic non-neuropathic pain begins to share a lot of similarities with the mechanisms and the qualities that people have from neuropathic pain. So once you get down the road a little ways in time, there's often not that much difference between the mechanisms and how people feel with pain.
Mm-hmm. Okay, interesting. So how do you, if you have a family doctor and you feel pain, but you have a spinal cord injury or paralyzed, because I don't know if anyone else has had this experience, but I certainly have. I've gone to my doctor and said I have pain, and they basically have told me that I do not have pain because you don't feel. So how could you have pain? So how do you explain that to doctors that maybe aren't educated in that way?
Yeah, it's sad that that's still the case, because it's not like this is new knowledge or anything like that. It's been around for quite a while. And I've met a lot of docs that do understand a lot about it, but I still come across some that don't get that. And particularly in the medical legal world, where you have people saying, well, there's nothing wrong in the MRI, there's no injury, therefore they can't possibly have pain. The knowledge that pain really doesn't have anything to do with tissue injury and has much more to do with the sense of how the brain needs to protect our body is gradually changing, but it's not filtering through to clinical practice very well. So what would you do? Well, something that most docs will understand, this might be one thing, is that when people actually lose a limb or it's gone, and like they've been an amputation or something, that most everybody understands phantom limb pain. So you can feel your phantom limb and it can be painful. That's the exact same thing with spinal cord injury. So just because you can't feel a limb that's still there, it's really no different at all than someone who can't feel a limb that isn't there. The same mechanisms pretty much apply. Not exactly the same, but a lot. So using that kind of a metaphor, be like, hey, doc, this is no different than phantom limb pain. Just because you can see my legs, I can't feel them, just like someone who's lost their legs can't feel them. And that phantom limb pain exists. Well, spinal cord injury, neuropathic pain also exists. So that's one thing. It could be useful to, you could in case they don't know about Pain BC Society, there's lots of knowledge and information and videos and stuff on there. And that would be a place to direct them if they've never heard about it before. It might be useful to even have an article or something, a PDF article in your back pocket or on your phone and say, hey, well, can I just send you this? This talks about all kinds of pain problems that people with spinal cord injury have. A review article, that kind of thing. It's tough though, because there's a power dynamic in the doctor-physician relationship, and unfortunately, it can make it often very difficult to, advocate with someone who's stubborn about their knowledge or their superiority or something like that, which is really frustrating.
Okay, thank you. There's a question from Marilyn in the chat box there. I don't know if you can read that, Mike.
Let me just click on it.
Mm-hmm.
There we go.
If anybody else wants to type in a question or a comment, or there's also an option to raise your hand if you'd like me to take you off mute and you can share your own story or whatever you like.
Mm-hmm. Yeah, so the question's about, is there a link or connection between autoimmune issues and chronic pain? Yeah, and certainly there are, like a lot of the classical autoimmune diseases like lupus and rheumatoid arthritis, irritable bowel syndrome has some immune connections. Anytime you have these immune issues, multiple sclerosis would be another one, encephalitis of certain kinds. Anytime you have autoimmune issues, then that can affect how the nerves are processing pain signals. And we actually shouldn't be calling things pain signals. There's a term called nociceptive signals. So those are the electrical signals that come from the periphery of your body up to the brain that inform your brain that there could be some tissue damage. So the immune system, when it's hyperactive or dysfunctional, can create pain problems regardless of what started it. So if you have an autoimmune disease, then there's a higher chance you're going to also have chronic pain of different varieties. It's possible even that fibromyalgia, which is probably a spectrum of a bunch of different kinds of problems, is likely has some kind of an autoimmune connection as well. So certainly there are some connections there. I think the immune system used to be thought of as, just something that was there to protect us from infection, or to help treat our own cancers, or try to take care of foreign things. But in fact, it's much more involved in just about everything in all of our systems, including even healthy things like learning. The immune system is actively involved in the brain in learning new knowledge and encoding knowledge and memories and all kinds of things like that. So it's quite an important system, and it has its fingers in everybody's pie, basically. So when it goes a bit haywire, it can certainly cause pain problems.
Thank you. Marilyn, how does that answer your question, hopefully? You're still on mute, though. Sorry. Hold on. I'm unmuting you, Marilyn.
Thanks. Well, Dr. Negraeff, I really appreciate that. I've been trying to research this myself, and certainly you've added to what my understanding already in two ways. The attempts of the nerves to heal themselves not being very helpful, and also the really global effects of dysregulation. I think I'm wondering about whether or not you're seeing, I'm an old injury, I'm 52 years now in a chair, and the last 10 years have had some immunological issues emerging. To me, they exaggerating some of the pain issues that I've been running into. I just hadn't thought of that. But I've certainly experienced its global effects. And I'm just wondering if people like me have a hard time tolerating any kind of medication, and I've tried the acupuncture thing and several other sort of, meditations and yoga and stuff like that to try and mitigate. Everything helps minutely, but I'm just wondering if you've seen, I guess my question is really, have you seen a lot of really old timers like me developing oddball things like immunological issues as a downstream thing, or is it separate? I'm just wondering.
Well, not necessarily just associated with spinal cord injury. I think I would just say more generally, as people age, we start to accumulate errors in our immune system and processing. So I don't know that there's any special risk of immunological problems or pain issues specifically from immunological problems with spinal cord injury, any more so than can happen to just anybody, even without an injury is what I mean. Yeah. They often go hand in hand with other things though. So if you have one autoimmune problem, you often have other ones as well. And so that can also compound problems. If you have one, you're at risk for other ones. So and again, it'll be great when, well, I hope it'll be great when we have we can better pin down what some of these immune molecules are doing and ways to counteract them. But there's a word of caution though too, because the immune system is so involved in so many different processes, that even when we find one particular immune signaling molecule involved in chronic pain, it's likely that it'll also be involved in other things that are healthy and necessary. So shutting it down may not be quite such a straightforward endeavor. And, we're going to need to be very specific about certain things or find things that are only pathological and not part of normal healing. But most of my reading tells me that that's not usually the case. We just have too much of this or not enough of that, but they're also involved in healthy regulation of a lot of our systems.
Great. There's another question there from Giancarlo.
Yep, I see. Okay. Could you talk about the various medications and if they have a specific pain type they target? Well, I used to say things like, if you have, tissue injury kind of pain, what we call nociceptive pain, then you take like your anti-inflammatories or Tylenol or opioids, that kind of thing. And if you had purely neuropathic pain, then you'd be taking something from the anticonvulsants or antidepressants for nerve pain. And you wouldn't really cross over too much. What I've discovered with just treating people over the years is that that's not really true. I take a much more practical approach now. I might start off sort of with that kind of scheme, but then say, look, pain's complicated and it's individual, and drugs have different effects on different people, and also the side effects are different from one person to another. So we have all these different medications we could try. Let's start with something that seems reasonable. And also, what are your preferences as a patient? Like what kind of, what have you read, or what have you heard about, or what do you want to explore? And then we'll just start exploring. I don't think there's any really right or wrong way, as long as we go about it safely and take your time and not do anything too crazy. So yeah, like, sure, if you have pure neuropathic pain and that's pretty obvious, then we'll start with gabapentin or pregabalin or nortriptyline and then kind of go from there. If you broke your arm and didn't heal properly and you still got an issue with that long-term, or you got some joint dysfunction, then we'll probably start with Tylenol and anti-inflammatories and opioids, knowing that we may cross over to the other class of drugs if it's not working, or use a combination of different medications but in smaller amounts to try to avoid the side effects. So not so much. I wouldn't say so much that you really match one drug to the type of pain.
Okay, Giancarlo, are you good? You can nod.
Yeah.
I can see you.
Yeah.
There.
Alternative meds.
Well, I think Andrew wants to share his alternative meds, but I will get to that in a sec.
Okay.
If you want to talk to alternative meds, and also Sam has a question there as well. So.
Well, okay, so nerve pain maladaptive. Yeah, nerves regrowing is a good thing, but the problem is that they don't tend to regrow very well. And there's no reason why they shouldn't be able to regrow without making neuropathic pain. Could it be a sign of recovery? Well, it could be, because sometimes when people do start to, like say in the first 6 months, if they start getting a little bit better, like a little bit of nerve recovery, sometimes you'll find some pain goes hand in hand with that. But I'm not so sure that that really means that the pain is coming because they're recovering, because people that don't recover also sometimes develop neuropathic pain months down the road. And other people that get some recovery don't get any neuropathic pain. So I don't think there's any research even that says if you're recovering, you're going to get neuropathic pain, and if you don't, you're not. The connection, I don't think is there. Sometimes we see things and we go, oh, well, maybe that's why you have pain. But in fact, I don't really think that's the case. I think we're looking for associations that aren't necessarily there, because as I said, sometimes people recover and there's no pain at all. I mean, I'm always amazed. Lots of people come through the unit and rehab, and they've got either a devastating injury or a minor injury, and they don't have any neuropathic pain. And then the next guy with the exact same injury has all kinds of neuropathic pain from early on. So yes, it's a good thing to recover, but it doesn't necessarily have to be associated with pain. And that's why I think it's a maladaptive problem, because it doesn't actually help anything, and if anything, it makes worse. Often a question I get early on is if I've seen somebody for pain and they're in those first couple of months and they obviously are very keen to get better and get some recovery, they're worried that if we treat their neuropathic pain, that we might stop them from getting better from the recovery. I think what happens is if people can feel anything at all, even pain or hypersensitivity to touch, they figure that's good, and therefore I don't want that to go away, and I don't want you to treat the pain. But we know that that's actually not the case, and none of the drugs we use are associated with stopping neurologic recovery. In fact, there was a study not that long ago that showed that in fact gabapentin and pregabalin drugs might be associated with with helping people get better, like associated with better outcomes, because sometimes when you had an injury, it's not just the immediate trauma, but the lack of oxygen and blood flow and swelling that goes on for days and weeks, and that can cause secondary damage and make your spinal cord injury worse or prevent you from getting better. And some of these drugs have effects on that in a good way, that they prevent some of that inflammation and swelling. And gabapentin and pregabalin might actually do that, and therefore be associated with better neurologic outcomes early on if they're used, and not worse outcomes. So that was kind of interesting research to be seen, and made me more confident to tell people not to worry about treating their pain in the early days, because it's not likely going to have any effect on their recovery. Thoughts on marijuana? Well, so yeah, we do. There is some research around marijuana and neuropathic pain. Not necessarily even specifically on like herbal cannabis, but on some of the cannabinoids, which are the active compounds in cannabis, that show they do have an effect on suppressing neuropathic pain. It's not dramatic. It's not usually like earth-shattering difference. You'll meet people from time to time that definitely do say it's a lot better than anything else they've tried. Often what I'll find is people are just, they have some pain relief, but they're doing better in other ways as well. Spasticity might be less, stress and anxiety are often a little less, their sleep gets better, and all of those things make the quality of life better and their ability to cope with any residual chronic pain better. So yeah, I think it probably does have a role. And like everything, even like with the other drugs, I think it's useful to consider it an experimentation to find out what does it do for you, how does it help or not, or does it cause any side effects? Some people don't like it at all. They get feeling kind of anxious and paranoid with it. Some people can't take very much, others can take a lot. So again, it's quite variable, maybe even more so than the other medications. How does one take care of an immune system? Some basic steps. I think that comes back down to just about everything in terms of just being healthy. Exercise, diet, nutrition, sleep. Your immune system can be a bit of a harbinger or a warning sign of like other stuff that's not well. And so if that's really the only thing you can do, is to just take care of yourself in as sensible a way as possible. Will that mean that you never have an immune system problem? No, it won't mean that, but that's just the basic taking care of yourself that will lead to less likely for you to develop autoimmune problems and other issues. And also, I should just stress too that it's not just autoimmune problems, like where your immune system attacks yourself. These processes in spinal cord injury, nerve pain, they're not necessarily autoimmune, they're just immune system involvement in flaring up the neurons. It's not quite the same thing as an autoimmune disease like lupus or rheumatoid arthritis. My doctor said he suspects we'll end up actually having my nerves removed. Okay, I'm not really quite sure what he means by taking your nerves out, because we typically don't remove nerves.
I have heard of people getting their nerves cut.
Yeah. We don't tend to do that much anymore. Like it used to be thought, well, if we just cut the nerves, the pain will go away. But that was before we really understood what neuropathic pain was. And another thing that we've done for certain kinds of nerves, like tiny nerves that go to some of the joints in your back, they can be heated up with a electrofrequency probe to make them not work anymore. So they're not actually cut, it just kind of screws up the proteins inside the nerves for a while so they don't transmit any signals anymore. And these are just purely sensory nerves. They're not nerves that go to muscles. You wouldn't want to do it to a nerve that goes to a muscle, or the muscle wouldn't work anymore either. So So that's called a nerve ablation procedure. You can ablate a nerve with heat or electrical energy, and it stops it from transmitting for a period of time, or 6 months, 12 months kind of thing. We don't do that in spinal cord injury. It doesn't really work for that, but it works for certain kinds of things, like when you have inflamed joints or arthritis in some joints of your back or your neck. It can work well for that. The other time nerves are cut on purpose is when someone has had a tumor, let's say, in their back, and it's felt that they could be cured or significantly helped if the tumor was removed, but the tumor is wrapped around nerves, like the spinal nerves that come off the spinal cord. Then sometimes they have to cut one of the nerves out as well and take everything out all at once. Some of those people don't get neuropathic pain, but a lot of them do get some neuropathic pain around that level where the nerve has been removed. So if you can avoid injuring nerves or cutting them out, generally speaking, that's a good thing. It does depend on the specific issues. There's another thing that's done for people that have terminal cancer is to actually inject some alcohol or phenol right into the spinal cord and a certain part of the cord that transmits pain, and that can cause a dramatic pain relief, let's say from a tumor in the abdomen or in the left leg or something like that. And that's going to, they're going to die from that in 6 months. Then you can temporarily block all the pain from that place with a nerve destructive procedure. But we generally try to avoid destroying nerves though nowadays. So yes, it is mostly out of date. What's the next one here? Why do some people have no pain at all? Well, that's a good question. And we would really like to know that, because if we knew why people with a spinal cord injury didn't have any pain, then by extension, we would know why the other people do have pain. Again, some of the research around looking at the spinal fluid, the fluid that's around your spinal cord at the time of the injury, shows that some of the chemical signatures in that fluid, the profile of these various chemical signatures can correlate with whether or not they have pain. So something about the way the injury happened, the way the immune system is trying to clean it up, genetics probably as well, which we don't fully understand either, but we know that there's a lot of genetic different, what we call phenotypes. One person's genes are different from somebody else's, so we know that those are all profiles that have something to do with why some people get neuropathic pain and others do not. If you have a complete injury, would you have less pain? Well, not really, no. Again, that used to be thought the case. Actually, it used to be thought it used to be thought that incomplete people had more neuropathic pain than someone with complete injury. But when they've looked at big studies of large populations of people with complete or incomplete injuries, the numbers of people that have pain are pretty much the same. So it doesn't really necessarily matter whether you have a complete or incomplete injury. You might have different patterns of the nerve pain, but whether you have it or not doesn't seem to matter if it's complete or incomplete, which kind of goes against what you might think, but that's generally the case. So I see people with both injuries that have no pain and that also have a lot of pain. Yeah, so just carrying on down here, I have a lot of GI problems with pain, usually due to trapped gas, which I take antacids for as our drug of choice. Could you discuss the effect of nortriptyline as an antidepressant? Okay, so it's not uncommon that I see either people with spinal cord injuries, but also without, who have what seems to be like almost like irritable bowel syndrome, but we wouldn't call it that, but just a lot of abdominal pain and bloating, and it may not have anything to do with their bowel habits. And I don't think we really know exactly what's going on, but for me, I surmise that what's happening is just like the nervous system's a bit cranked up and making your limbs or your skin painful, it can also mess around with how well your bowels work and also just how sensitive they are, so that if you have just sort of normal function in the bowels and things are moving like they're supposed to be moving, you might be hypersensitive to that feeling, and it might be just kind of aggravating, or it actually might become actually painful. And we can call that visceral hyperalgesia. The viscera are your organs inside your body, and if they're hypersensitive, that's a kind of hyper painful situation. And so it's called visceral hyperalgesia. Is there a drug of choice? Not really. Again, it really depends on what's going on. They can do first of all, you have to kind of make sure there's not some specific GI problem, like an ulcer or, colitis or something like that. And a GI specialist can rule that out by doing some tests or looking down or looking up and just making sure there's no pathology. That's kind of like for all kind of pain, that's rule number one, is to just make sure there's not some primary tissue injury kind of problem. If there isn't, then it's more of a functional kind of pain problem. And then you're back to kind of experimenting a little bit to see what works. If you get help with antacids, well, then maybe it's really more an acid problem and not anything to do with the spinal cord injury per se. So I can't really say there's a drug of choice otherwise.
Can I say something there, Mike?
Yeah. Yeah.
So just because I get to,
Yeah.
Giancarlo, actually, I have exactly the same experience. I've had it for 3 years. I get excruciating pain. I actually thought it was nerve pain for quite some time, because no one could figure out what it was. I did every test known to mankind, and I always thought it was gas related, but I couldn't, because I can't release gas no matter how much pressure I put on my stomach or whatever it is. I don't have the ability to do that. So, I went through every test. That I went even to a gastroenterologist. He gave me some suggestions about medications to take, which I never took. And actually what I did is I Googled it and I tried different diets. So I actually just tried, I tried first wheat, and that didn't seem to work. I tried dairy, that didn't seem to work. And right now I'm on what's called a FODMAP diet. Since then, I've been on that. I've actually found that garlic and onions are a huge trigger for me. So it's like instantaneous. As soon as I put garlic or onions into me, I all of a sudden get bloated and have extreme pain. So I know there's other foods that will do that to me as well, but that's also another option, is just to look at your diet and maybe even a naturopath where they can do a blood test for allergy testing to see if there's any specific foods you might be allergic to. So I've just found this in the last 3 years, and I've been in a chair for 21. So that's.
Yeah, it's a good point. I think, things are a lot more complicated than we know. And whether that has anything to do with a spinal cord injury or not, I don't think we really know either. Like, is that because your spinal cord injury changed your bowel function and you got sensitized, or would it have happened anyway? I don't think we really have the answers to that. But sometimes that can be a problem where the spinal cord injury becomes like a red herring for, other issues.
John wants to say something. He's just got on the situation.
Hey, Mike, how you doing?
Oh, hey, John, how are you?
Good. Just been sort of popping in and listening as I've had time here.
Cool.
Quick question. One thing that I've found in relation to spasticity is that sugars and basic carbohydrates that break down into sugars quite rapidly tend to cause my spasticity to get considerably higher. I don't really get a lot of neuropathic pain, but I do have an incomplete injury. And along with that spasticity, I also get sort of a hypersensitivity. I'm just wondering if there's any, anybody that's looked into the relation, or if there's any research into the relation between inflammatory things like sugars and how they affect pain.
Yeah. Not that I'm aware of, but that doesn't mean it doesn't exist. And it would make some sense to me given how this role of inflammation in the body is thought to be such a bad thing for so many things. There are a lot of people around that are really convinced about the various roles of diet and foods in chronic pain and other areas. The research hasn't really kept up with that in terms of large studies that could really convince us beyond a shadow of a doubt that they have a role. But that's not to say that they don't, because I know that a lot of people similar to yourself have said, have told their own stories around changing the diet and how much that had an effect on their pain. It's just that we can't point to any big research studies that can nail that down any better. So I think that's part of healthy living, and also part of like exploring a little bit and being open to just trying different things and see what it does for pain and spasticity. But no, I don't know of any particular research, but it'd be great if we had more.
There's a couple other questions there from Sam. And I think one from also Giancarlo there, who
Nortriptyline
at the end there. Yeah.
So nortriptyline nortriptyline and amitriptyline and desipramine, these are all a family of drugs that were known as tricyclic antidepressants. They were used for depression in the 50s, 60s, 70s, and 80s to a certain extent. And then when we got the SSRIs like Prozac and citalopram and these other drugs that were a little safer for people with depression, because you couldn't overdose and kill yourself with them, where you could overdose with nortriptyline and die, which is not necessarily a good thing, obviously, when you're depressed, to have a drug you could kill yourself with. So they replaced the nortriptylines of the world as the antidepressants. But turns out that these drugs that are known as antidepressants, the way they work, they increase certain neurotransmitters like serotonin and norepinephrine. And those neurotransmitters are important in the downward inhibition from your brain down to your spinal cord. The pathways that inhibit hyperreflexic signals or hypersensitive nerves. So when you take a drug like nortriptyline or amitriptyline and it increases those nerve transmitters over a few weeks, it makes those pathways that go from your brain down to your spinal cord that suppress pain work better. And as a result, they can have a positive effect on neuropathic pain and other forms of chronic pain too. On top of that, because they do have a lot of side effects. One of them is sedation. You don't have to take them all throughout the day. You can just take the dose at night, and if they make you a little sleepy and you're having a problem sleeping because of pain, it helps that as well. The downside, of course, is that they have strong, what we call anticholinergic effects, which means they can make your mouth feel really dry. They can make it harder for your bladder to empty, and they can give you constipation, and they can make you excessively sedated even in the morning the next day. So they do have a number of side effects. Again, some people will be able to tolerate it quite well if you go up slowly, but others really can't take them very well at all. And then in spinal cord injury, every once in a while I'll see someone where the nortriptyline makes their spasms worse, or their peripheral, in the legs, the blood flow will kind of shut down. They get cold and mottled and kind of jumpy and spazzy, and it's a worse situation than before. So once in a while someone will react that way. And I'm not really sure why, but it's not really a good drug in that case then. So that's how those drugs work. And so, I'm always careful because I always tell people when they say, well, what is it? I say, well, it's an antidepressant. And they go, well, I don't want that because I'm not depressed and I don't want you treating me with antidepressant. And then I have to kind of back up and say just the story that I just told you, which is why they're called antidepressants. But when we use them in lower doses for neuropathic pain, they don't really treat depression anyway. Yeah. So does nerve pain get better over the years? I think it does. I think for most people, it kind of burns out a little bit. Not everybody. I know mine certainly has. It used to be a lot worse and more intense. Some people don't get neuropathic pain right away, and a year or two later down the road they do. But over the longer term, 10, 20 years, I see a lot of people where it just seems to be worse or better. Now, whether it's actually lower or whether they're rating it lower because it doesn't bother them as much anymore. I mean, like psychologically or how they get on with their day, it may not bother them as much anymore. I don't really know. All I know is that people often say, yeah, it's not as bad, or I'm doing better with it. And it could be a number of reasons. But generally, I do think that's the case. And sometimes we say, they get tired, the nerves get tired, they calm down, they burn out. And those may not be accurate things to say, but that sort of seems to be what happens. Pain's a complex thing. It's like, I often say it's like, even like taste. If you put some salt crystals on your tongue, you taste salt, but how much salt? How salty is salty? It's kind of like how painful is pain. It's all very relative. And on one day you might say that that's really salty, and then on another day where you're really tired, you might say it's not very salty. Like your brain decides how salty is salty with a whole bunch of different inputs. And it's the same thing with pain. Yeah, there's a problem in your spinal cord or your knee joint or your hip joint if you have arthritis, and that's part of the factor. But beyond that, your brain and your nervous system and all kinds of things going on with you inform just how painful is the pain. So over time, things can change, and people may feel that their pain isn't as bad or doesn't bother them as much anymore. Am I still involved with anesthesia though? Well, I'm a member of the anesthesia department. I go to the rounds and the department meetings and whatnot, but I don't actually give any anesthetics anymore. And I don't do epidurals or spinal injections or any kind of injections at all. Once in a while, I start intravenous's on people up on the ward if the nurses are having trouble, just because I've probably put thousands of those in, and it's kind of like riding a bike, you don't forget. But otherwise, no, I'm not involved at all, and I would be very afraid to give an anesthetic again. I'd be worried about some major mishap happening and not being able to deal with it. So, no. Okay, got to go. All right, bye, Andrew, if you're still there. Has anyone reported less pain with antihistamines, like cetirizine? Not specifically, I wouldn't say, but again, I come back to anything's on the table. So really, any kind of drug that suppresses the nervous system a little bit, like your central nervous system, your brain, spinal cord, probably will have some pain relieving effect, like even alcohol and other kinds of things. Go, Teri. All of these things can have an effect on pain. So I would not be, if someone said to me, hey, I have a lot of nerve pain and it's pretty stable, and then I started taking antihistamines for my seasonal allergies, and all summer my nerve pain was better. What's up? I'd say, well, yeah, probably. It doesn't surprise me, because antihistamines involved with the immune system, and they are sometimes sedating. Usually cetirizine isn't, but sometimes a bit sedating, then could have an effect. Having said that, it's not something I've heard very often at all, and I haven't seen any literature on on the antihistamine specifically being good, pain drugs. Have you noticed that, Marilyn? Is that why you asked that question? Just going to unmute you.
I'm going to unmute you, Marilyn.
I mentioned I have trouble tolerating any sort of drug, but I have chronic urticaria, which the doctor prescribes cetirizine for, and it works fantastically well on the urticaria. But I also, maybe just what some of these other things you've mentioned, the calming effect on the overall nervous system. I find I do sleep better with it.
Yeah.
What I can't tolerate is a stupid groggy head for hours and hours in the morning. So for me, the cost it really is a trade-off. And the itching has to be insane before I try it, because I can't cope too well with the stupefaction. That for me is a downside. But anyway, yes, I did notice that there was generally less pain. And I have a lot of joint issues at this point in time because I'm an old timer, and sore shoulders and stuff, quite a bit of arthritis, blah, blah, blah. And also carpal tunnel issues. And I found that all of them eased up a bit. And maybe it's just the anti-inflammatory side of antihistamine or something, It's just an oddball thing. I don't think it's an effective strategy. I would never recommend it, as a way of managing pain. It's too costly. But it's an oddball thing that I thought I'd ask you about.
Yeah, no, I haven't come across it, but like I said, I wouldn't be surprised. Well, I'm not surprised that you told me that. And now I'll probably be listening a little bit more to other people and their allergy treatments, whether they've noticed some connection with pain. Like over the years, I've heard connections between pain and just about everything you could imagine. Sometimes they're kind of one-off, but I might, in my earlier days, I might have been kind of dismissive of it, like, well, that doesn't make any sense, or, you must be imagining that or something. But now you hear things enough and you go, yeah, okay, that's plausible. If there's some plausible connection, then I just accept it. And I pretty much accept everything that people say, because pain's such a personal thing. Like, it's not like you can say, no, you're wrong. No, Marilyn, you're wrong. It didn't help you. Like, that doesn't make any sense to say that, right? It's only you know what you feel. And if you've drawn the conclusion about that, the only time I'd say something about it is if I thought things were dangerous, or what somebody was doing was kind of dangerous for other reasons, and that's not dangerous, obviously. Then I'd sort of caution them or something like that. Well, I was going to ask somebody a question about. Well, another thing is anti-inflammatories, like just even simple ibuprofen. Isn't supposed to help neuropathic pain either, but over the years, I've heard a lot of people associate that, or they've discovered it accidentally, like they had a headache or their shoulder, they hurt their shoulder or their wrist or something wheeling around, and they took some ibuprofen, and then they noticed their neuropathic pain was better, and they thought, well, maybe that's just a one-off, and then they began to explore it a little bit more. And so occasionally you'll meet people that have found anti-inflammatories, even though they can potentially have a lot of other side effects on kidney function or or ulcers and whatnot. But you'll find sometimes people will find that that's really quite helpful for the neuropathic pain. And they're not supposed to do that. But again, what we think is supposed to happen is not always what happens. CBT and neuropathic pain. So yeah, cognitive behavioral therapy, which is really just a way to get at challenging our beliefs or our thoughts, or how we act and behave about our pain, particularly if those thoughts or behaviors are not very supportive to our function, and if they can be challenged or changed, can overall affect the quality of our life and increase our function. And it doesn't matter if it's neuropathic pain or some other kind of pain, it can have a positive impact and a positive role. There are lots of different forms of psychological intervention. CBT is probably the most well-known and widely used, and there's even different kinds of CBT, but there are other kinds of therapies that are like that or complementary, like acceptance and commitment therapy, which means, trying to accept what's here now, even if you don't like it, and what kind of commitments can you make to creating change or changing behavior, that kind of thing. Hypnotherapy and visualizations, whether they're actually mental visualizations or auditory or tactile visualizations, these can be useful. Virtual reality, immersive virtual reality. There's quite a bit of research on that in acute pain and also becoming a lot more in chronic pain, especially as the technology improves. A whole range of kind of psychological tools, basically, that can be used to help with neuropathic pain. Even just learning about pain, like learning how it works, how our brains and bodies make pain, can be empowering and useful and allow people to figure out new ways to help themselves. And before I leave that, I wanted to actually remind myself to tell you that there's a good book out. Some of you might have come across it. It's been around for a little while now, called Explain Pain. And Explain Pain is written by two physiotherapy researchers in Australia and New Zealand that have studied pain a long time and various different ways to help it. So that book it basically explains a lot of this stuff we were talking about: neuropathic pain, the immune system, the endocrine system, thoughts and behaviors and whatnot. It can be ordered online. I think you can actually get it on Amazon too, but it's mainly through their website in Australia, the Neuro Orthopedic Institute. And I don't know if, Teri, you have ways to sort of get links out to people later or something. Yeah. So
absolutely. I didn't tell you guys that I'm actually recording this right now. I put it in my email, but just so you all know that I am recording this, because a lot of people were very interested and wanted to get the information out. So
wanted to watch it again later.
There you go.
So Explain Pain can be useful. And they've made a new book called Explain Pain Supercharged. And so it's kind of an updated version of Explain Pain, but it goes a little deeper as well into the science, like around the immune system. And it talks about receptors and uses a little bit more scientific language, but I think it's still accessible. It's written in a light and sometimes humorous kind of way, both of these books. So if you want to kind of dig deeper into understanding pain science or pain neuroscience, you could start with either one of those books as an option. What other resources? There's a Facebook page too called Explaining Pain Science, EPS. And it has a whole, it can be a bit, what's the word, adversarial. It can be a lot of arguing on that Facebook page, but that's what makes it kind of interesting too, because we have a whole bunch of physical therapists and chiropractors and massage therapists and everybody, a few physicians and some nurses and a whole bunch of patients too on that Facebook page. It's got something like 7,000 members now, or 8,000 members. So that can be an interesting place to go and just ask questions or read some of the posts and the comments, but it can sometimes get dragged down a bit in negativity as people defend their practice or their kingdom. Sometimes the chiropractic group will get really upset if people are saying, well, if everything's a little too airy-fairy with the brain science kind of stuff. But anyway, it can be useful as another place to go if you take it with a grain of salt. Is that my internet connection, that little message that I saw, Teri? Or we're good? You can hear me? Okay.
Yeah, you break up a little bit, but it's
okay.
actually not bad, so.
Did it? Okay. Something about my internet connection was a bit sketchy there, it said. Okay. Whoops. There we go. Sort of an aside. Come across any patient with spinal cord injury, epidural spinal block during a C-section or surgery? No, I haven't seen anybody with a cord injury that happened during an epidural or spinal block from a C-section or surgery. I've seen a lot of people who've been injured from an epidural infection, usually from drug abuse, and an infection, which is sort of similar. And I've seen a lot of people who've had a spontaneous bleed, like a hematoma that happened in their spinal canal, sometimes from like an arteriovenous malformation or a subarachnoid hemorrhage or something like that. Various kind of ways, or someone who was maybe on a blood thinner and had a spontaneous bleed. So I've seen other ways. So I'm not surprised that it could happen. I just haven't come across somebody. So you were injured 14 months ago in your baby's birth. I'm sorry to hear that. Nerve damage from the anesthetic and now I've caught a quina. Yeah. So yeah, I don't really know what could have been exactly, without knowing the details a little bit more, if there was a bleed or whatnot. Sometimes there's been some, so rarely when a needle is placed in or around the spinal canal, it can have a trauma to a nerve. It's quite rare, but it can happen. But you can also have the anesthetic itself as sometimes associated with some nerve injury or nerve dysfunction. It's not really fully understood why. Again, it's rare because millions and millions of these are done and usually nothing happens. But yeah, so case is still a mystery to the doctors. Yeah, is it a complete injury now, Sam? Just curious.
Sam, I'm just going to unmute you if that's okay, and then you don't have to keep typing in.
Yeah.
Go ahead.
Hi, Dr. Negraeff.
Hi.
It seems to be incomplete. I've had a lot of recovery since
Right.
the injury, but I still have a lot of weakness in my glutes and hamstrings and all that, as well as a very impaired sensation still.
Mm-hmm. Mm-hmm.
So if anything, I would say the sensory component is worse for me. My proprioception is more or less gone in my ankles and my toes and all of that. I have a little bit at my knees, but I mean, it is changing, but I mean, I know you guys probably don't want to get into too specifics, but anyways, they haven't really given me a prognosis because it's so rare.
Yeah. Yeah, well, and there's a whole other condition that's basically inflammation of the nerve roots called arachnoiditis that, is just sort of swelling and scar tissue around the nerve roots. So, but off most of the time, we don't know why it happens. Sometimes with a bleed, it can, the blood causes some scarring around the nerve roots, but that's not your case. So, yeah, there are a number of things that can happen that are kind of strange and we don't fully understand them. And Michelle said she had idiopathic cauda syndrome, probably from a virus. So yeah, and viral infections can cause inflammation and scar either. Yeah, Michelle said on the support group, there's some people who've had a cauda syndrome from spinal block during delivery. Yeah.
Michelle, do you want to just type in the box what your Facebook group is, if you don't mind sharing with everybody, and also Michael.
Yeah, I'm going to do it right now.
Yeah, your Facebook page again. I have no idea how this gets recorded, so I'm going to, from Michael, said it was explaining pain science. I also wanted to mention that I actually took a course on pain. It was through actually UVic, but they have it all throughout the province, where they have coaches that come in and teach a 6-week course. And it's just really about, in a sense, essentially, it's kind of like, if anyone has heard of brief action planning, but like breaking down on a day-to-day basis what you can do with pain or for pain without, I mean, aside from drugs and things like that, but other alternative stuff. And I feel bad Andrew didn't get to share his alternative therapies, but I'll make sure that I connect with him so he can share it on our newsletter. But this is the book that I got. Oh, heavy. I can't see it. Anyways, it's called Living a Healthy Life with Chronic Pain. And it's really informative. So it's probably very similar to sort of what you have also, Mike, with Pain BC. Like just sort of like just different, in the course, they take you through different chapters of the book. And some of it is visualization. Some of it is, just, what can I do today? Rather than having such a long-term vision, like, oh, I have so much pain and I can't work out or I can't do this. Well, what can I do right now, right? And really breaking it down to small pieces, and it really helped me. And the other thing that really helped me too about it is being really honest with it, and honest with it with the people that are around you. Because a lot of the time we're trying to like suck it up and be like, well, I'm not really in pain, but it's really affecting my personality, or I don't want to go out, or I don't want to do this. And just saying like, you know what, my pain level right now is an 8 out of 10. And I would really love to go out and meet my friends and do whatever, but maybe you guys could come to me, or maybe we could just make it another time. So it helped me a lot, just with some other things that we can do with our own mental state of affairs. So, yeah,
totally. And you gotta find your own path with this too, and pull things together that work for you. Just because I say something or somebody else says something doesn't mean that's the right thing for you. So don't leave it all up to experts or people in the know or who are connected. Like, you want to try to ask people as many questions as you can, but because we don't have like a one place for everything kind of clinic setup, where it'd be like, my dream would be like, you got pain, all right, no matter where you access the healthcare system, the emergency room, your GP or a nurse practitioner or your physiotherapist, no matter where you kind of went in and said, hey, I need some help, I got pain, that immediately all the options would be available to you, like education, learning about pain science, nutrition, activity, pain medicine, medications, nerve blocks if they're appropriate. Like immediately everything would just be sort of like available. So you didn't have to go through 16 steps to find out what doesn't work. And you didn't have to go to this person only to find out they can't help you, and then go to that person. Meanwhile, you wait for 6 months, and then you wait for another year. Like that's just not working for us. And there's all these silos, and that's just such a big problem. We need to be able to go to one place, or at least enter the system at one place, and then not have to be re-referred to 10,000 other places. And that way you'd be much more quickly be able to put together a team. So because we don't have that, we kind of still have to navigate on our own, and find, talking to each other, things like this, talking online, joining the Facebook groups, and then piecing together what works for us and being an advocate for ourselves. Of course, it's really hard to sometimes advocate for yourself. You're tired and in pain all the time, and so it's really hard to advocate and see you've been beaten up and slammed down by the system so much you don't even want to try anymore. So that's a big part of the problem. That's a big part of the Pain BC's work, is trying to break down a lot of that as well, and make things more accessible to people. There's another thing Pain BC has too. I don't know if you know about this, but it's called Pain BC's not Live Plan B, Connect for Health. Connect for Health basically has volunteers trained to connect you to resources, essentially, especially things around, you know, social resources. So Pain BC's Connect for Health, I don't know just go to their web page is be the best way to find out about it. painbc.ca, just put that into the box there. If you need help connecting to resources, they'll even help you try to find a GP if you don't have a GP. Basically, any kind of question like that, they'll do what they can to help connect you, navigate you through the system. Yeah. So did I miss some other questions or no?
No, I'm gonna repeat. I'm just gonna repeat because, like I said, I don't know how this gets recorded. So, Facebook page from Michael, Explaining Pain Science. Books are Explain Pain and Explain Pain Supercharged by Larimer Mosley and David Butler, and that's noigroup.com. And then thank you, Nicole. That was yes, correct. Selfmanagementbc.ca/chronic disease program is the course that I took. Thank you. And from Michael, also Pain Management Portal, also with Pain BC at Live Plan B, and that's be.ca. And from Michelle has something in there, Facebook for Cauda equina syndrome. Equina, I can't even say it correctly. There are a few groups. She's a member of all of them. And they have a women's only group, which is secret, so you won't find it if searching, but once you join the main group, ask to join, and one of us will get you in. And then just look for her, Michelle. I won't say her last name on the recording because I don't know. Yeah, and there we go. And Leslie, I'm very excited for you to be coaching that. I think that's good. And painbc.ca from Michael. And I would love to hear if anybody has any like stories they want to share also. Or Michael, do you have anything else that you wanted to add? Sorry.
No, that's good. I've been talking a lot. So I would like to hear people's stories or.
Yeah, does anybody have anything
question
they want to, that you can like raise your hand or you can nod? I can see all of you except Michelle, Marnie, and Marvin and people who are on the phone. And then I can unmute you. I just don't want to unmute you all at one time or whatever. I'm looking around. Kim is just fixing her hair, I think. Anybody? I want to hear from someone. Someone's got a story to tell, I'm sure. Karen, I know you have a story. I'm unmuting you. Hold on, I'm unmuting you.
Is that Karen March?
It is. The three of us all used to race together back way in the day, so we've known each other for quite a while.
Yeah. Hey, Karen.
Hey, how are you?
Good. How are you doing?
I'm good. Yeah, I'm finding this all really helpful and interesting. I think I'm like, my issue is 30 years later experiencing pain. So for the first 25 years, absolutely nothing, clear break, never felt a thing, never, nothing. And now it's like so intense. So, but you had touched on something, it's hard to tell, especially with the aging in the spinal cord. Could it be herniated disc? Could it be all these other things that are now just presenting like neuropathic pain?
Yeah, it could be. It could be. So, I mean, another thing too, like that can be a late complication is syrinx or syringomyelia in the cord, where you get a bit of fluid build up inside the cord just from the way the fluid flows in and around the cord. But sometimes that can be a late complication. You can only really tell about that with an MRI scan. But usually you have some other symptoms besides pain too, like changing neurology, whether spasticity's changed or levels have changed or sensation or motor powers changed a little bit. Usually that goes with it. So
Is it common to get a syrinx this
no, it's not.
long in the game?
Well, yeah, it can happen later. I don't know if it's more common later than in the first few years, but it can happen later. It particularly is more of a problem with people if they didn't ever have a surgery to kind of straighten things out a little bit in the first place, if they're allowed to heal in a crooked kind of way or not.
Right.
I don't know if you had surgery or if you had
Fused.
yeah. So that minimizes it, and that's why pretty much everybody gets a surgery now to kind of fuse the spine. Used to be we just kind of put people in braces or into the
Well, I had that too.
halo.
So I had a halo
The
first.
halo too.
Yeah.
You got a surgery later. Yeah.
Surgery, yeah.
So it might be something just to go and talk to someone about, just to, say, hey, this nerve pain's come out of nowhere in the last little while and I never had it before.
Yeah.
What should we be looking for?
Well, that's my second question, because I've had the experiences quite possibly like Teri, where the first two people I've seen so far think it's in my head because they're like, you shouldn't be experiencing pain. So you sit there and you're like, well, I don't know how else to explain this to you, but I can assure you, because, and also secondary with being quad, is getting autonomic dyslexia with it. So I'm like, I can assure you I'm feeling pain, but just, yes, I'm finding it difficult over here on the island. And the first practitioners I've seen have not been very knowledgeable, maybe.
Any physiatrists you saw at all?
Well, that's going to be my next thing. So I'm off to the doctor next week to get, a referral to see a physiatrist, because I think a little more knowledgeable, hopefully. And
that would be good. A lot of them have come through and done their training at GF Strong and whatnot too. Right. So, and if that doesn't work, then get a referral to like somebody at, the I-Cord Blessing Pavilion, the spinal cord center there.
Yeah.
Wilms, somebody. Yeah.
Okay.
There's somebody who specializes in spinal cord medicine a little bit more.
Yeah. Great.
Mm-hmm. Yeah. Good to see you.
Sorry, I muted Karen already, but I'm fast on that button.
Click on the button, yeah.
I know, sorry. Just Giancarlo has to leave, so he was just wondering if there's any other antidepressants with less side effects that are also anti-pain.
Yeah. Well, different side effects like Cymbalta, or duloxetine as it's commonly called, is also an antidepressant, and can be better or sometimes worse, but different. I would say different in terms of side effects, not so much dry mouth and sedation and constipation, but can cause other kinds of problems. So I think it's, again, trial and error a bit, and desipramine has a little bit less side effects than nortriptyline. Stay away from amitriptyline. Amitriptyline's a bad one. Like, there's really no reason to be on amitriptyline. So, someone else, Michelle, said Cymbalta worked well for her. So Cymbalta is certainly where I'd probably go next, because it's kind of a different antidepressant than nortriptyline, if nortriptyline was not good for you.
Okay, Thank you. And then Michelle says, she's in Victoria as well. Karen, you got a new buddy. Is there any place you should check out there?
Is there any place to check out? Like, you mean like a physician or somebody?
I would assume so. Like, Michelle, I'm assuming, Michelle, can I unmute you? I don't know if you're on. Do you have a microphone? I'm unmuting you so you can talk to Dr.
Sure. Can you hear me?
We can.
Yay. More so, I have a wonderful GP, but not surprisingly, he missed the start of my coda equina because I'm a unicorn. There's absolutely no reason for it. So there's no surgical intervention that could be done, and as a result, I have incredible neuropathic pain along with every other host of complications. And he's been really struggling with best ways to treat me because I'm on the island. I mean, I've heard, there's some lower mainland, GF Strong, all that kind of jazz, but nothing here. I've been to the 3 pain clinics here, and they've all said, can't help you. It's neuropathic. Just wondering, with your knowledge, if there's somewhere here. And of
So
course,
like,
travel's hard because I can't sit down and I can't drive and I can't run or, walk. So.
mm-hmm. Yeah, and they wouldn't help you with like medications, that kind of thing?
Well, we've been working really hard on a cocktail, and up until about 4 months ago, we had my pain somewhat under control, but like MS, I seem to go in really strong waves, and it's been a really bad one. So he was, as he put it, trying to find a brain trust or something. Right now I'm on a mixture of Cymbalta, fentanyl, T-Freeze, Ativan, you name it, and we're just kind of trying to hit it and get some kind of quality of life going. So I told him I was listening in on this, and he said, well, ask if there's anywhere I should send you or refer to over here.
Mm-hmm. Yeah, and somewhere on the island, eh?
Just because travel is really hard. I'm sure with Coda Aquinas, sitting is very difficult. So
yeah.
getting on a ferry, and I can't drive. My legs don't work anymore, so it's a bit of a challenge getting over.
Yeah, like not other than like the pain clinics there, like the Royal Jubilee, which I assume that's what you meant. You went there, or
yes, I did the Jubilee Pain Clinic. I did a private pain clinic, who was very nice, sort of out in the middle of nowhere, and then one out in Sydney.
Yeah, I don't know of other resources, unless I wondered about a physiatrist as well, but they're going to have to be someone that really kind of specializes in pain a little bit. But it sounds like your GP is also.
Or you wonder about a physiatrist? What is that?
Yeah, a rehab medicine doctor, like a physical medicine and rehabilitation. They're the guys that do the rehab for spinal cord injury and whatnot.
Oh yeah, I was in rehab when I came out of the hospital for 6 weeks, and then he followed me for a year, the rehab doctor, through Victoria General, and basically got to the point of, I can't help you anymore, but I'm here if something comes up.
I kind of feel like you might be at the point where it's all of the other things as well, like the quality of life stuff. Yeah, I'm not sure there would be any other medical therapies other than, I don't know, I guess lidocaine infusion or ketamine infusion or something like that. But those aren't really available or offered.
They did try to do the lidocaine, and it turned out I was allergic. So that was pretty nasty and exciting.
Yeah.
Anyway, I know it's not all about me. I don't want to type all the time. I just was curious if you had, any thoughts. But it sounds like maybe Vancouver is the best bet.
Michelle, Sam has a couple things there for you also in the chat box there.
Yeah, I saw that.
Yeah,
Thanks.
and also for Karen too. You saw that? Okay, good. Okay, good. Kim,
Thank
you have
you.
something to say? I saw you put your hand up. Yep, unmuting Kim. Kim, you're on.
Hey, hi. I have a question. I live in the Lower Mainland, so I do have access to the physiatrist. And I've dealt with this since I was injured when Hugh Anton was just a resident, and at that time, nobody knew anything about neurogenic pain, and basically he came back to me and said there was no pain medication, and he said basically the thinking at that time was just get on with life and hopefully you won't notice it as much. Since that time, there's been a lot more resources, a lot more research and information available about it, but even with the physiatrist at GS Strong, I have been trying different medications for years, and they all seem to have different medications of choice, and nothing works.
Yeah, that's kind of what I was saying at the beginning. Is we don't have a lot of new stuff at all, and it's you kind of run through the half a dozen or 10 different medications that you might sort of consider consider as somewhat useful, and if either they don't work very well or there's too many side effects, there's not really anywhere else to go from a medical point of view, because it's it's not something that you can treat with a procedure. It's the nervous system itself's all jangled up, basically. So if you've been through that already, then it's not likely you're going to find anybody else who's got an answer to it, unfortunately. In terms of like a new medication or something, because we're still waiting for those.
We are. That's why we participate in research.
Yeah.
So just being cognizant of the time here, Michael, I know you said that you had around 8:30. It's now 8:35. So I want to give you the opportunity to be able to bow out.
Sure.
If you need to. And I graciously thank you for all your amazing expertise in being here. If I can speak for everybody, like I'm sure we all are just so grateful to have this opportunity to speak to you. And thank you. And
you're welcome.
Yeah.
I wish we had more better answers and more treatments we could offer. Then we wouldn't have to do these things. We would just sort of treat everybody. But unfortunately, that's still where we're at.
Awesome.
So, yeah, thanks for the opportunity, and nice to meet you all. And thanks for your interest and your questions.
Awesome.
All right.
Thanks, Mike. Have a good night.
You're welcome. Take care. Bye-bye.
Bye. And for everybody else, I still would like to welcome you to share your own ideas. I still do have like 17 of you on here right now. So I don't want to necessarily unmute you all for fear of mass chaos. But if you do have something to share, I would really love to hear it. I think right now you have the opportunity to be able to unmute yourselves if you would like to take the chance to say hi.
Hello?
Hello!
This is Yurik. I was on the phone and I had a question, but I was unable to unmute myself.
Oh, you know what?
That's okay.
I'm so sorry, but I am very, very happy. If you have a question, I will pass it on to Dr. Negraeff myself.
I know Mike. I know Michael, so I can always set him up on an email anyway. And it was just something I just wanted to. It was a story of mine that I wanted to see what he thought.
Well, we would love to hear your story if you would like to share.
Okay, it's I'm always dealing with I'm always in some sort of pain all the time for the past 15 years. The medications just sort of keep it bearable. But there's only none of the medications that ever give me oh, this is great feeling. But once I got a bladder infection, and I was at home, and I didn't feel like going to the hospital, so I sort of rode throughout it with the chills and the pains and just taking ibuprofen, and then eventually I fell asleep. And then when I got up in the morning, there was no pain, there was no spasm, and it was so calm. I even thought I tried to just get up out of bed, like I thought I was able to walk and everything was just a dream. But eventually everything came back, and I was just wondering what happened to give me that small window.
That is a very good.
I don't know if anybody has ever experienced that, but I was just curious, is there some sort of mechanism that drains the pain receptors, or I don't know.
Has anyone ever experienced that can help Uric with their home? No.
No, I guess. Well, yeah.
Marilyn,
Yeah.
I think you can unmute yourself now if you'd like to say something. I gave you all the, oh, hold on, maybe I didn't. There we go. Okay, I'm unmuted you all. Yeah, okay, I muted you all, but you have to unmute yourself. Nope.
Can you hear me, Teri?
Yes, I can hear you.
Okay, so it's Kim. Can I?
Oh, I have both. Hold on, Kim, put yourself on mute for 1 minute.
Okay.
And Marilyn?
Well, I don't have much to add there, except that I too am a cauda equina neurological injury, and it was 30 years for me as well when I experienced neurological issues as a result of the cyst forming below the injury site and so on. And it was accompanied by spectacular amounts of pain. So I'm not quite sure which speaker was wondering about changes after 30 years, but I'm here to say, gosh, that it was like starting over again. So those events can sadly pursue us if we have the audacity to live a nice long time after our injuries. Lots of things can happen. And with regard to the fever reset on the pain levels, I've experienced something analogous to that, but it is a short-lived, and it does kind of relate, in my mind at least, to what Dr. Negraeff was saying about, something that helps calm the neurological noise down, and in this case, sounds like it was a fever. Just gave you a temporary reset on the noise level in the nerves. That's what it sounds like. So the body is a huge mystery. And anyway, rather than ramble further, I was just going to chime in on those two aspects.
Thank you so much, Marilyn. Kim, you're on, my friend. And Marilyn, can you mute yourself again?
Sure.
Sorry, I can't mute you.
Sure.
And then Kim can unmute herself.
Did Marilyn ask a question that she wanted an answer to, though, or?
No, it was Uric who had that. Yeah.
Okay. I was just wondering how other people feel, because Teri had mentioned, we all deal with pain. Obviously, a lot of us have chronic pain because we're here tonight, which causes other problems, and there's bladder issues, bowel issues, etc. As far as telling, I'm not sure what other people do, but Teri had mentioned sometimes we need to just be honest with people and tell them what our situation is. And I find that's not. I mean, most of us have been injured a long time in this, and it sort of seems like it's now we're going through it a second time, as someone had just mentioned. I mean, I've been through this for many years, and I still don't feel comfortable telling people. Mm-hmm. Part of it is because they think we've done so well so long. Mm-hmm. I'm not sure that people want to hear it. Mm-hmm. I don't know what other people feel.
I don't know. I think that people want you to be honest with them, and I think they get it. They don't get what we've been through or what we are going through, or the magnitude of that. Mm-hmm. But everyone can experience a sense of what you've been through, of loss, of grief, of sorrow, of pain, of happiness and joy and experiences. We all have the same basic human emotions, right? And so to be able to share that with people and be really real because it makes it real for yourself. And I think truly that's what we hide from sometimes, is
Yeah.
I don't really want to be honest with myself about how I'm feeling. And if we can be honest with ourselves and be able to allow people to help us with that, it is amazing the generosity that people have in their hearts to be able to like reach out and assist you. Like I've been very blessed to be able to have that experience. And I hope that like a lot of people, everybody experiences that, whether they have a disability or not. Like it's just human.
Yeah.
Yeah. Anybody?
Anyone?
Nicole, we haven't heard from you. Hubert, we haven't heard from you yet either.
I'll say something, Teri.
Oh, Sam, yeah.
Hi guys. Just to touch on the same thing. I mean, I feel like every day. Sorry, I'm gonna get emotional. I feel like every day someone says that I inspire them in some way by how well I'm handling this, how well I'm coping with it. And sometimes I just want to say, fuck you, I'm not handling this well, you know? But I think spinal cord injury and things like that are so misunderstood. The general public just has no idea what we go through. They just think you have an injury and then you don't feel anything and then you just go about your life. But obviously, like, being in a chair is the least of our problems. I don't know if you would all agree, but that's at least my situation. And I do think it's better when you tell people, because I get so frustrated when people always say you're coping so well, and I'm like, well, maybe I should not be coping so well, so that you all like actually realize how shitty this is for me. I don't want everyone to think that it's all just roses and sunshine because I happen to be able to put a smile on my face and like hold my cute baby. Like, you know, it doesn't necessarily make it better, but I don't like people just thinking I'm doing so great and we've just moved on with our life. I mean, does that mean I want people to feel sorry for me? That's not what I want, but I don't want them to just say, wow, you're so strong. Mm-hmm. Anyways, I don't really have anything beyond that, but.
No, I think that's a really amazing point. And thank you, Sam, for bringing that up, because I'm sure like a lot of us too, you know, especially those of us who've been in a chair for a really long time, really forget that, you know, and, you know, we hear the word inspiration and strength and, you know, so many times in our lives. And, you know, wow, it's so great. I could never do what you do. Like, you know,
no
yeah. And it's like, well, you know what? Like, yeah, maybe you're right. Maybe you couldn't. Maybe you would take a different choice, right? But yeah, I mean, I think being honest with them with how you are is like, yeah, this really sucks. Anyways, Marilyn, I think you want to say something. So.
And I am speaking from a different era, you know. So I just wanted to acknowledge both of you, what you've articulated, the honesty piece. I think there's more acceptance for a bit more honesty when the injury is new. Not to say it's easier for you, Sam, because the suffering is so acute.
I know what you mean, though. I know what you mean.
Yeah, there's an expectation. You might even hear, well, you'll be great in a year, you know, and maybe you won't, you know, like that, all that stuff, they're trying to be encouraging. Mm-hmm. But the fact is that there's, you know, that might not be what you're looking at. But I think, speaking as somebody who was expected to adapt myself to fit the able-bodied picture, I was expected to keep all that stuff under wraps, and any sign of what I was dealing with was not tolerated, not even in my family, but certainly where I went to school. If there were bathroom issues, all that stuff, it was not mentionable. I couldn't address it in any way. You know, I could not betray that this is what I was up against. So I think it's important to remember that that's where we're coming out of. The headspace hasn't changed utterly, you know. And old timers like me, we learned to shut as much of that down in order to function as we could. What I've noticed that over the years of not listening to what my body is screaming at me, like maybe you should lie down for 5 minutes rather than bite the nose off the person in your immediate vicinity. I'm still learning to pay attention to that, and I've been at this a long, long time. So it's not like that's a learned thing to hide all that stuff, and to try and unlearn that and pay attention to what your body is actually saying, and to identify, hey, wait, I'm in so much pain, I can't even concentrate. So if I lie down for maybe 15, 20 minutes, things brighten up for a short time, and you realize it's not that you're in a bad mood, you're in too much pain,
Yeah, it's usually the pain talking.
Yeah, exactly. And it deranges you, and people don't know, what you're, so you got a frowny face on and you don't even realize it. Resting bitch face, it's just for us, But anyway, but the other thing is, like it's not a static thing. I don't know, we expect ourselves to be able to perform our job our 8 hours on a regular basis, and we're not an established quantity. And as you get further along in life, you discover some days you have this much energy, but you don't know it. You set off to accomplish something, and you haven't got the wampum to do it. You get partway into this and realize, okay, today I've only got, I don't know if you've heard the spoon analogy, but that's, you got 11 spoons to get through the day, and you spend 3 of them getting to work, and work takes more than your remaining spoons, and now you got to get home, and maybe make dinner even, and you're out of spoons. Anyway, it's been I think it's not just honesty, I guess, is my overall thing. It's a moving target. We're a different quantity every day. I really enjoyed what if that's the word, what Dr. Negraeff said about the interaction between what the body's trying to do to heal itself is, in terms of these tendrils, of nerves, and amping up of the receptivity of nerves, and also the complex interaction of the immunological factor, because we all are usually fighting some bug or other, usually a bladder bug, of some degree or another, and that's gotta shorten the wick, and you don't know where you're at even with that most of the time. So I guess I'm just saying, yes, I agree with Teri. Be honest if you're aware what your issues are, and try. And I guess maybe the only add-on is survival meant for some of us learning not to pay attention to our bodies, and it's really hard to unlearn that. And that even if I think I've got the hang of it, the quantity varies day to day. So you don't know what to expect yet. In terms, I've actually asked a physiatrist this very thing. How do I assess my fitness? How do I assess my functioning? And what is my standard? And she couldn't offer me any sort of answer. Nobody's ever been able to answer that. So in a way, it's a normal thing to understand. You don't want to match myself to. You want to strive for something reasonable, but not kind of overshoot what's reasonable. And it's tricky. It's a really tricky balancing that. And it's at my stage of life, I think it's oddly similar to what you're facing, Sam, because everything's new for you. You have no idea what to expect, really, of yourself from day to day. Everything's changing all the time. And maybe that's true for us all. I don't know. So throw that out there. Maybe other people find that their energy levels change every single day.
Absolutely. I think that, Marilyn, that's a great point. Thank you so much. Yeah, I do think that everybody's energy level really changes from day to day, and But Hubert, Georgina, Michelle, Nicole, Marvin, I liked what Marnie said down there. Thank you, Marnie. That for a lot of us, it is true that it's not just about being able to walk.
Yeah.
And we can relate to that for sure. I know I can. I know Kim can. I know Nicole can probably, because I just know those people. But we are here. So, I mean, that's why we have these groups, is that we can share these things with each other. And I'm glad that you're here with us. And yeah.
Thanks.
Hubert, Georgina, Michelle, Marvin, Marnie, any callers? You have the ability to be able to mute yourself at this point.
I was gonna say,
Hold on one sec. Marilyn, can you mute yourself?
Sure. I was just going to say thank you for the invitation.
Oh,
Just wanted to get that in.
Thank you. Okay, Michelle, yeah, you're on. Thank you for showing your face.
Hi. I was gonna say, when I was, I guess, when was this? Like 7 years ago, all of a sudden I got really bad pain, and I've been injured since I was 10. So whoever it was, I don't remember, that was talking about pain all of a sudden coming. And I actually saw Dr. Negraeff at that time. And they gave me all sorts of meds and whatever, gabapentin, all that stuff. And they could only figure that it was like nerve pain or like my bones wearing down and rubbing together is what they thought. And they were talking about maybe shaving something off because I had broken my hip after my injury, but they didn't set it or anything because of my osteoporosis. Can you guys hear me properly?
Yeah.
So that was incredibly painful. So I feel your guys' pain on that one. It was very frustrating because you didn't know what was going on. But then to address the randomness of it is, I was seeing a physiatrist, I was seeing Dr. Negraeff, nobody could figure anything out. And then I got pregnant and it all went away. So like, talk about not knowing what relates to what, like antibiotics or whatever. There might be something that causes something that you don't even realize. So it's probably hormonal or something, but it's never come back as bad as it did before for me. But I do also, I am more aware of taking it easy and stuff. Yeah, I know that's the thing, is that you can't exactly get pregnant, but yeah, so yeah, it can be so frustrating. Like, it'd be nice if they could figure out things, right?
Yeah.
Come up with new medicines or new ways of dealing with things. Yeah.
I have been doing acupuncture. Does anyone do acupuncture?
I did.
Did it help?
Yeah, I had rotator cuff injuries, and I couldn't lift my arm up. I couldn't lift my arm up completely, and after one session, I was able to lift my arm, my arm up this far. I could only lift it part way, and after one session, I was able to lift my arm up completely. So,
cool.
Good work.
I did it when I came first out of rehab, and unfortunately, it just, because my damage is in the coda-equina nerve bundle, and it just sent everything screaming, and I ended up back in hospital. So I've never been brave enough to try it again.
Okay.
Doesn't mean it doesn't work for other people.
I mean, I've been doing it. I wouldn't say I'm getting pain relief from it, but I'm doing it with the hopes that it's helping me heal. I mean, I've had slow, consistent recovery for the whole time since my injury.
And you said you were 19 months or something? How long?
14 months.
14 months, yeah. So
yeah,
you were probably told, I mean, typically they say 18 to 24 months, right? That's your recovery window.
I mean,
it's not a hard and fast rule.
Yeah, I agree. I mean, I think I've put every effort into maintaining my muscles as best I can, and I think things like acupuncture are good for that, because it's meant to increase circulation and blood flow and all of that. So my understanding of it is that the nerves continue to grow ultimately for years, but typically within 2 years, the muscles have atrophied to the extent that they can't really come back again. And yeah, so that's kind of, I suppose, why I'm just trying to focus mostly on just maintaining whatever muscle strength I can and health in my legs.
I go to a registered massage therapist, and she's quite wonderful. She does a lot of visualization and such. I thought it was interesting. The doctor was saying that really kind of only, from the way he expressed it, the only kind of hope on the horizon is the virtual reality, and I think, and the visualization that comes with that. So I found that quite interesting. But I'm 3 years, and I progressively have gotten worse. So unfortunately, I didn't. But then I was a unicorn how I got it too. They've never seen another one of me either. So.
Oh well, we're the same unicorn because they haven't seen me either. Isn't this the worst thing you could ever hear? Is we've never seen anything like this before.
Well, I probably at one point had 7 specialists when I was in the hospital, and they all wanted to write papers on me. I'm like, can I see first what's in it?
Can I ask what your actual injury was, or was it during a procedure, or it just?
I have no idea.
Oh wow.
My legs started feeling numb, and then I thought I had a bladder infection because I started having really bad saddle pain, and kept going back to the doctor, kept getting tests. He's searching, he can't figure it out. Finally, I lost complete control of bowel as well as bladder and legs, and my doctor called 911, and they got me into a neurologist. I didn't know any of this, of course. All they kept saying was, when did you hurt your back? I didn't hurt my back. Where does your back hurt? My back doesn't hurt.
Wow.
So, and then they were very honest and said, we know exactly what you have. You're exactly classic, but we have no idea how you got it. And to this day, they have no idea how I got it.
So there was nothing on MRI. There was no bulging disc.
Nope.
Wow.
Nope. The best guess is I had an influenza B 6 weeks before I ended up in hospital, and that it somehow crossed the blood-brain barrier and had a good old time running up and down my central nervous system and settled in the coda equina. So essentially, I got a meningitis, except I didn't get it in my brain. I got it in my butt.
Okay.
My brother, he is now 50, so when he was 14, actually got viral meningitis from influenza B. So the best guess is there is a genetic predisposition that allows these viruses, in our case, to cross that blood-brain barrier, because they shouldn't. That's what the blood-brain barrier is there for. But anyway, that's, but I did want to tell you and mention, people were talking, I have found for me, it's been support groups. That's what's kept me sane and whole. Because while, I agree, we want to be honest with our friends and family, I have a 72-year-old mother who cries herself to sleep because she's so worried about me. And
you don't want to be
not fair.
No one wants to be around someone who's sad all the time.
No. And I think it becomes almost self-reinforcing. If I was actually honest with everyone who says, how are you today? And said, I'm in freaking pain, that's all I would say every day, right?
I don't see the problem with that, to be honest with you. But again, being conscious of time, I want to give the opportunity to Georgina, Marvin, any of our callers, an opportunity. We're after 9 now, so does anyone else want to say anything, or should we?
Well, I think it's great to end on a laugh, you guys.
Yeah,
that was great. You got me laughing.
Okay, good. So I guess we just need new friends then? Is that?
Yeah.
No, but I don't know. I think sadness and honesty are 2 different things. I just look at it differently. I don't think you need to be sad. We all have sadness.
Sure.
You don't have to be oh my God, la la la. But about being honest is just about, actually, I am not having a good okay today, you know?
Yeah.
Yeah.
No, I agree. I didn't mean to be dismissive.
Yeah, no, I appreciate that. No, but it's true. Like, I don't think I would explain it to everyone like that. Like, if you have your 72-year-old mother who worries about you anyways, probably not a good person to be honest to.
Exactly. That's why for me the support groups have and that can be, hey, you know what guys, I achieved this today, even if it was I poured my own tea, to hey, I'm done, I want to end it today because I can't do this anymore. And and we all, I'm sure, go from one pendulum to the other, and sharing it is awesome.
Absolutely. Well, thank you, oh my gosh, I'm so excited to see all of you in person. It's been awesome. And thank you so much.
Thanks for the opportunity.
I'm going to actually I'll send you yet another email again and just get your feedback because I'd love to be able to find out how this worked for you. They're actually developing this program nationally, which is really cool. And so this was like the pilot project a year ago, and now SCI Canada wants to take it on. So we're kind of the test subjects for this. So
awesome.
Yeah, it's pretty exciting. So I'd love to hear your feedback, and anybody who is in Vancouver area, I'm just going to give you a heads up. I will give you a heads up on Monday, but we have our big 60th anniversary coming up. It will be on October 26th. You will be getting an invitation to attend, and I really would like to see you in person there because it's at Blesson Spinal Cord Center. Free booze, free food. What more do you want?
We're there.
It'd be really great to see you all there. And thank you all so much. Love seeing you.
Yeah, you guys too.
Yeah. Bye.
Have a good evening.
You too.